We're working with, confidentially, I can't reveal the name of it at this point, but we're working with a large UK health provider who we'll call ABC, for want of a better name. And ABC has a call center of 500 staff, which is onshore. It's expensive, but it's actually woefully underbuilt. They need double that call center capacity, and they are considering building a new one, which will cost them £11.5 million, or maybe even shutting down the existing one and building another call center, which is twice the size to hold 1,000 people. But the alternative is using artificial intelligence to have conversations with their clients, and that would leverage their existing call center employees enormously. It would give each one the power of 10. And so, what is the actual use case? Let's look at the specific details of it. I'm just going to share something because we have a slide from before. Just give me 1 minute. Let's see.
Look, slide. Even Stephen has opportunity to get AI to plan his slides for him.
So by AI, the problem with AI is often is that they're not plugged in. They are discrete little things which live in a box on your web browser or on your mobile phone, and so that is a very big frustration for all of us. Thank you for pointing that out, Karl. So the current priorities for this provider are that they want to have 100% outreach in all their health screening programs. They provide health screens to the big corporates in London, the banks like UBS and JP Morgan, and not those names exactly, but they offer free health screenings to all of their employees. And those employees are not taking them up. Between 40 and 60% are taking up their free health screening, which is provided by the employer, which is crazy because it's a really good service. And it's also losing a lot of revenue for their healthcare provider because they can only charge for the screenings which they have done. So they were set this target of reaching out to everybody who's eligible for a screen and trying to persuade them to come in, and they failed. They've used some of the basic techniques like emails and letters, but those are saturated, and we all know that as soon as there's a cold outreach campaign method that's easy, it's useless because it gets saturated. So that doesn't work anymore. So they're failing on their outreach because they tried calling people and they just don't have the capacity. They were reaching 10 or 20% of the people that were eligible for their screens. And by the way, these are hard-nosed financier or investment banker types. If they know that they're getting something for free, the chances are they'll take it up. But they were just not aware of it. So this is the big problem that they have. They also have another issue in their company, which is secondary care leakage, because they have a large number of primary care physicians who make referrals to specialists, and then those referrals get taken up out of network. So they lose all that revenue because it goes out of their company. They weren't giving the good client-patient service. There was a big gap between what they were delivering and what they should be delivering. I mentioned the call center capacity. And they had a holding company from the United States, which was scrutinizing them because they had a high concierge-based service versus the more more supermarket type US service. And so the US managers were giving them a lot of scrutiny, saying, "You guys need to do more with less. You're not shaping up." So this was the genesis for our pilot, and we do multimodal outreach. And so here's an example. I'm just going to play it for you, just to show you what it looks like. Oops, if I can get it working. Okay, that one's not working. Let's go straight to the video-based pilot. This is me talking to. Can you hear this, Karl? Is it coming through okay?
Nope, not yet, Steve. Nope.
Nope. Okay, I know what's the problem. Sorry, guys, give me 1 second. I'm just going to stop sharing and share again because there was a 3 years old. There we go. Okay. Can you tell me? Okay, let's go back to the beginning. All right, let's play it.
Hello, this is Sarah from Dr. Lewis's office. May I speak with Stephen?
Hi, Stephen speaking. How can I help you?
Hi, Stephen. I'm calling to remind you about your breast screening appointment. We noticed you missed your last one, and we'd like to emphasize how important these screenings are for early detection.
But I don't have any breast cancer in my family. Is it really important that I attend? And I'm only 53 years old.
I understand your concern, Stephen. While family history is a risk factor, Most breast cancers are diagnosed in women without a family history. Regular screenings are crucial because they can detect cancer early, often before any symptoms appear, making treatment more effective. Your health is important, and we're here to support you in staying on top of it.
Okay. Sorry, I'm really in a rush. You're going to have to speed up and cut to the chase. What are the have you got any stats to back this up, please?
Of course, Stephen. Statistics show that regular mammograms can reduce breast cancer mortality by about 20%.
Because I'm going to stop this because I think the idea has been conveyed that, this is responsive. It was listening to me. It was actually going on a little bit. So you probably saw my frustration leaking out at one point, but it does respond. So you can interrupt it and you can talk to it a lot like a human. Um, and it's responsive, it's persuasive. I wanted data-orientated persuasion, but somebody else may have wanted emotional reassurance. And the important part about AIs is that they can be adaptable and they can tailor their message to meet the requirement of this specific caller, and it's persuasive. It really works. I mean, there was a study which was done in Switzerland in March 2024, which showed that GPT-4 was 81.7% more persuasive than a human. And that was an old model, right? That was GPT-4. And now we've gone through that and GPT-4o and GPT-01 and o3, and the models are getting better. And we've got Grok, which is even more persuasive. So that was an old statistic. This is another one of those lines on the chart that we showed at the beginning where AI is getting more persuasive than people. And we're trying to use it for beneficial purposes. We sold this concept to HCA that they really like it. And we also went through some of the other issues with them, like what are the issues going to be? Like,